There are nights when insomnia doesn't appear as the absence of sleep at the beginning of the night, but rather as a subtle intruder in the middle of the night. The body falls asleep, but doesn't remain surrendered. The room is dark, the environment silent, and yet the eyes open on their own. You look at the clock. It's 2:47 a.m. And this scene repeats itself with almost mathematical precision, night after night. It is not a coincidence. It is not an accident. It is the body trying to speak. And this attempt at communication may carry valuable clues about what is happening in your body, your mind, and even your emotions. Waking up in the middle of the night on a recurring basis is a phenomenon far more common than people realize, especially among individuals over the age of 60, and it should not be treated as a mere discomfort. What takes place is not just a disruption of sleep, but the interruption of the physiological repair process that should occur during the night. And the effects accumulate like an invisible dust on the body and mind, affecting mood, immunity, concentration, memory, and vitality. Sleep science has increasingly shown that waking up multiple times during the night is often linked to the fragmentation of sleep cycles, especially the deeper stages known as N3 and REM. It is during these stages that the brain carries out the most important processes of cellular regeneration, memory consolidation, and emotional stabilization. When these stages are interrupted, the body simply cannot complete those functions, like a worker who is prevented from finishing his task every 2 hours. The result is a persistent fatigue, even after seemingly long nights. Many people say they slept for 8 hours, but woke up feeling as if they hadn't slept at all. This happens because it is the quality of sleep, not just the quantity, that determines its real impact on health. Among the main physiological factors associated with nighttime awakenings are the irregular production of sleep hormones, such as melatonin and cortisol, the natural progression of aging, which shortens the deep sleep phase, and chronic health conditions like sleep apnea, chronic pain, diabetes, and urinary disorders. But there is also another factor, more subtle yet equally decisive, the emotional state of the person at bedtime. Anxiety, worry, sadness, and unresolved grief can not only make it difficult to fall asleep, but also generate a state of unconscious hypervigilance during the night. It's as if the brain does not feel completely safe to fully relax. And when this happens, even the slightest internal or external stimulus can trigger a sudden awakening. Chronobiology, the science of the body's natural rhythms, shows that each organ has its own internal clock, and the body goes through specific metabolic peaks at different times during the night. For example, liver functions concentrate between 1 and 3 a.m., and lung functions between 3 and 5 a.m. It's no coincidence that many awakenings occur during these windows. According to traditional Chinese medicine, which for millennia has interpreted the body as an integrated energy system, these times correspond to overloaded organ meridians. Although this approach hasn't been fully confirmed by Western medicine, it is drawing increasing interest among researchers, exploring the relationship between hormonal cycles, organ performance, and nighttime wakefulness patterns. Studies published in the scientific journal Sleep, one of the most respected in the field of sleep neuroscience, reveal that frequent awakenings between 2 and 5 in the morning increase levels of chronic inflammation and impair the natural release of growth hormone, which is essential for muscle and bone regeneration, especially in the elderly. In addition, these awakenings raise cortisol levels in the bloodstream, a hormone that, when present in excess, is directly linked to accelerated aging, lowered immunity, muscle mass loss, and worsened depressive symptoms. Ignoring the pattern of recurring nighttime awakenings is like closing your eyes to a warning from your own body. The repetition of the hour is like a code, and understanding that code is the first step to reclaiming full restorative sleep. The path involves observing the pattern, noting the times you wake up, identifying habits, reviewing medication use, and above all, refusing to normalize something that signals imbalance. The body speaks, but it doesn't shout. It whispers. And waking up in the middle of the night is one of those whispers. Listening closely may be the key to restoring deep, silent, and complete nights. Sleep is a profoundly active process. Contrary to what many believe, the brain doesn't shut down when we fall asleep. On the contrary, it enters one of the most complex and intense states of processing, organization, and repair the human body can experience. During the deepest phases of sleep, especially N3 and REM, the brain performs a true biochemical cleanup. Recent memories are organized, neural connections are reinforced, toxins accumulated throughout the day are cleared from brain fluid, and a wide array of hormones are regulated to maintain balance across the immune system, mood, cognition, and inflammatory responses. When this process is interrupted even briefly, the entire chain of repair can be compromised, and the damage, though subtle at first, accumulates over time and affects both mental and physical health. Waking up in the middle of the night fragments sleep cycles, preventing the brain from completing its full phases. An ideal sleep cycle lasts between 90 and 110 minutes and should occur 4 to 6 times per night. When sleep is constantly interrupted, the brain is forced to restart these cycles incompletely, which especially compromises memory consolidation and emotional balance. Studies from the University of California have shown that individuals with fragmented sleep suffer significant short-term memory deficits, increased difficulty concentrating, and reduced decision-making ability. This effect is even more pronounced in older adults, whose brains naturally experience a decline in cognitive processing speed. The disorientation upon waking, that sensation of confusion, a foggy mind, not knowing what time it is or where you are, is a direct reflection of an abrupt interruption of deep sleep. This kind of awakening signals that the brain has been pulled from a profound rest phase into an alert state without a natural transition. The immediate impact is noticeable, but the cumulative effect over weeks and months is even more concerning. Repeated sleep interruptions impair the function of the pineal gland and reduce melatonin production, which is not only the sleep hormone, but also a powerful immunity regulator and antioxidant. When melatonin production is chronically inhibited, inflammation levels in the body rise quietly and persistently. One of the most studied mechanisms in this process is microglial activation. Microglial cells are the soldiers of the brain's immune system. They are responsible for identifying and eliminating waste, defective proteins, and potential neurological threats. However, when sleep is constantly disrupted, these cells enter a state of hyperactivity, releasing inflammatory cytokines that, rather than protecting, end up attacking the brain's own tissue. This silent inflammation is associated with several neurodegenerative diseases, including Alzheimer's, Parkinson's, and vascular dementia. In other words, a brain that doesn't sleep well is a brain that silently falls ill. Furthermore, fragmented sleep directly alters the hypothalamic pituitary adrenal (HPA) axis, which regulates cortisol production. Cortisol, when released at the right time, is vital for the body's functioning. But when its release is dysregulated, especially during the night, it contributes to anxiety, high blood pressure, insulin resistance, and a weakened immune response. It's no exaggeration to say that interrupted sleep can deeply destabilize a person's hormonal and immune balance within just a few days, and even more so in older adults, whose biological resilience is naturally lower. What begins as a simple nighttime awakening can eventually become a trigger for accelerated aging. The brain has no way to restore its vitality unless it's allowed to complete its full sleep cycles. And that permission depends on two factors: a conducive environment and the absence of interruptions. So, when you notice that awakenings are becoming routine, it's time to let go of the belief that this is normal for your age and recognize that this pattern is an urgent call for reorganization. The brain needs rest to take care of everything else. When sleep fails, everything that depends on it also fails. And the price in this case is far higher than just a few hours of daytime fatigue. For a long time, sleep was believed to be merely a passive state in which the body rested and the brain shut down. Today, however, we know that sleep is one of the most sophisticated and strategic functions of the human body. Sleeping well is not simply about resting. It is a complex process of internal reconstruction. And within this process, there is one phase that stands out as the heart of true rest: deep sleep. It is not just important, it is indispensable. During this stage, the body carries out tasks that simply cannot happen at any other time of day. And without it, physical, mental, and emotional health inevitably begins to weaken. Deep sleep, also known as slow-wave sleep or N3, is the most restorative and intense point of the entire sleep cycle. It typically occurs during the first few cycles of the night, following the initial stages of falling asleep and the stabilization of neurological rhythms. In this stage, the brain drastically reduces conscious electrical activity, the heart rate slows down, breathing becomes more regular, and the body enters a state of near total stillness. But inside, intense work is underway. The pituitary gland releases large amounts of growth hormone, which is essential for cellular repair, muscle strengthening, and the regeneration of bones, cartilage, and tissues. In addition, the immune system is activated more powerfully, releasing anti-inflammatory cytokines and vital proteins that defend against viruses, bacteria, and defective cells. When this phase is interrupted, the body quite literally loses its biological repair window. Memory consolidation also depends directly on deep sleep. During the day, the brain gathers an enormous amount of information, but it is at night, in the depths of sleep, that these memories are sorted, organized, and transferred to regions of the brain where they become stable. This process, known as synaptic consolidation, is essential for turning learning, names, faces, stories, and acquired skills into lasting memories. In older adults, the reduction in duration and intensity of deep sleep is one of the main factors associated with progressive memory loss, not due to pathological forgetting, but because the brain fails to integrate information during the night. In other words, when deep sleep is not reached, memories are not securely encoded, and this affects everything from simple daily tasks to more complex cognitive functions such as planning, organization, and language. The impact of deep sleep also extends to mood and emotional balance. Numerous studies show that people who fail to reach this phase of sleep adequately are more likely to experience irritability, anxiety, sadness, and lack of motivation. This happens because deep sleep helps regulate levels of neurotransmitters like serotonin and dopamine, substances directly linked to well-being and the sensation of pleasure. Without this nightly chemical reset, the brain starts the day in deficit, more vulnerable to stress and with fewer resources to handle daily frustrations. This scenario becomes even more delicate in old age, when emotional adaptability to life's challenges is already more demanding by nature. It's crucial to understand that the decline in deep sleep is not an inevitable part of aging. While there is a natural tendency for sleep to become more fragmented with age, it is entirely possible to recover part of the depth of sleep through specific changes in routine, diet, environment, and emotional state. Practices such as morning exposure to natural light, reducing artificial lighting at night, using low-frequency sound, establishing relaxing bedtime rituals, and carefully managing medication can significantly increase both the frequency and duration of N3 sleep. And that translates into greater vitality, sharper clarity, better cardiovascular health, and longer-lasting functional independence. Neglecting deep sleep is like giving up the most noble form of repair the body can offer. It's like failing to take your car in for maintenance for months, ignoring the sounds, leaks, and malfunctions. Eventually it breaks down. The body is no different. Deep sleep is the invisible mechanic who works while everything seems still. But if that mechanic is interrupted every 2 hours, the restoration is never complete, and what should have been a night of renewal becomes a sequence of empty interruptions. Sleeping deeply is more than resting. It's surviving with quality, it's aging with clarity, it's waking up whole the next morning. As we age, sleep ceases to be an uninterrupted territory. Many elderly individuals begin to notice a clear pattern of nighttime interruptions, frequent awakenings, and a lighter, more fragmented sense of rest. Waking up once or twice during the night, getting up to use the bathroom, shifting positions, or simply opening one's eyes in the dark for no apparent reason, becomes part of the nightly routine. But why does this happen? What exactly changes in the brain and body of an older person that makes them sleep so differently from how they did in their 20s or 30s? The answer begins with the very architecture of sleep, which undergoes deep transformations with aging. The brain ages, and as it ages, it changes how it organizes the stages of sleep. The total amount of deep sleep, particularly the N3 phase, decreases significantly after the age of 60. While a young adult may spend up to 20% of the night in this restorative stage, a healthy elderly person rarely reaches even 10%. This means the older body spends less time in restorative sleep and more time in lighter phases, especially N1 and N2, which are far more vulnerable to noise, discomfort, internal changes, and external stimuli. It's as if the brain sleeps with one ear open and part of it constantly on alert. Another central factor is hormonal production. Melatonin, known as the sleep hormone, is produced by the pineal gland in response to darkness, but the body's ability to produce melatonin drops sharply with age. Studies show that in people over 65, melatonin levels can be as much as 1/3 lower than in youth. This makes it harder to fall asleep, stay asleep, and reach stable deep sleep throughout the night. At the same time, there is often an increase in nighttime cortisol release, especially in people living with chronic stress, pain, or untreated anxiety. This imbalance between melatonin and cortisol creates a biological environment in which sleep is constantly disrupted. There is also the issue of circadian rhythms, the internal biological clock that regulates our sleep and wake cycles. With age, this internal clock tends to shift forward, making older individuals feel sleepy earlier in the evening and wake up earlier in the morning. This phenomenon, known as circadian phase advance, explains why many people over 60 feel drowsy around 9 at night and wake up around 4 in the morning, even if they still feel tired. This pattern is not necessarily a problem, but when misaligned with social and environmental demands, it can create a feeling of sleep deprivation and discomfort. Add to that the physical factors that become more common with age. Muscle pain, arthritis, acid reflux, sleep apnea, diabetes, high blood pressure, and frequent urination are all conditions that, on their own, can interrupt sleep. But together, they turn the night into a true obstacle course for continuous rest. And the body, being interrupted repeatedly, begins to adapt. It learns that it cannot fully relax, and in doing so, it reinforces the cycle of vigilance and sleep fragmentation. It becomes a silent, vicious cycle where the body itself starts to doubt that nighttime is a safe place to shut down. It's crucial to understand that this lighter and broken sleep pattern should not be accepted as normal just because it's common. It is frequent, but not natural. Aging does change sleep, yes, but it does not eliminate its importance. It is entirely possible through strategic adjustments to restore some of the depth and continuity of sleep even after 70 or 80 years of age. The key is to observe the body's signals, adjust the environment, care for emotions, review medications, and create a routine that respects the body's new rhythm. Elderly individuals do not need to accept that waking up several times a night is an inevitable part of life. They can, and must, seek to restore the quality of their sleep, because sleep at any age is the invisible foundation of health. It is entirely possible to sleep for 8 hours and still wake up exhausted. It is possible to lie in bed all night and yet rise with the feeling that your body carried a heavy burden while you slept. This happens when what should have been continuous rest becomes a sequence of fragments. Interrupted sleep, especially when it occurs frequently, creates a kind of fatigue that cannot be resolved by simply spending more hours in bed. It is a structural, deep exhaustion that affects multiple systems simultaneously. The mind slows down, patience wears thin, memory falters, and the body becomes more vulnerable to illness. What's most dangerous is that these effects aren't always immediately noticeable. They settle in slowly, silently, until they become the new normal for how the body functions. The impact of fragmented sleep first targets the central nervous system. When sleep cycles are interrupted, especially during the deeper stages, the brain cannot complete its functions of memory consolidation and emotional regulation. As a result, the individual becomes more distracted, more reactive, and less capable of organizing thoughts. Small lapses in memory become more common. Simple words vanish from the mind for seconds. Everyday objects go missing. Appointments become jumbled, and all of this is often brushed off as just aging, when in truth they are direct symptoms of poor sleep quality. In studies conducted by Stanford University, older adults who experienced frequent nighttime awakenings performed 37% worse on memory and attention tests, even when sleeping 7 to 8 hours a night. The total amount of sleep didn't make up for the disruption in its natural architecture. The immune system also suffers. During deep sleep, the body releases substances that strengthen its natural defenses. When sleep is fragmented, the production of these substances is impaired. This means the body becomes more susceptible to respiratory infections, joint inflammation, and degenerative processes. Additionally, there is a drop in the activity of natural killer cells, those responsible for detecting and destroying damaged or tumor cells. Studies from the University of Chicago showed that people deprived of deep sleep experienced up to a 70% reduction in the activity of these cells, significantly compromising immune surveillance. In other words, even with sufficient sleep time, those who experience frequent interruptions don't fully recover their natural defenses. Another critical effect of interrupted sleep is metabolic dysregulation. The body starts producing more cortisol and less leptin, which increases hunger, decreases satiety, and promotes the accumulation of visceral fat. This type of fat, in turn, is directly linked to higher risks of type 2 diabetes, high blood pressure, and cardiovascular diseases. Even in people who do not gain weight, metabolism becomes more insulin-resistant and more prone to blood sugar fluctuations. Put simply, interrupted sleep silently alters the chemical balance of the blood and sets the stage for chronic diseases. In older adults who already have a natural tendency toward metabolic resistance, this imbalance becomes even more pronounced. Mood is not spared either. Partial sleep deprivation, the type caused by repeated interruptions that prevent natural progression through sleep cycles, significantly increases irritability, impatience, and the tendency toward deep sadness. This happens because a sleep-deprived brain does not adequately produce serotonin and dopamine, neurotransmitters directly linked to well-being and motivation. A study from the University of Toronto revealed that older adults with fragmented sleep patterns were twice as likely to develop moderate to severe depressive symptoms, even with no prior history of depression. Interrupted sleep also disrupts regulation of the brain's amygdala, a structure directly involved in the perception of threats. The result is a more anxious brain, more defensive, more reactive to everyday stress. Over the long term, poorly consolidated sleep accelerates the process of systemic aging. The skin loses brightness and elasticity, muscles weaken, blood pressure becomes more unstable, and the risk of falls increases. That's because deep sleep is when the body performs cellular repair, metabolic waste clearance, and fine-tuning of the cardiovascular system. Without this complete stage, the body begins to fail in maintaining its own balance. And this occurs even when someone believes they're sleeping enough, because what matters is not just sleep duration, but its depth, continuity, and quality. Frequent nighttime awakenings, therefore, are not just a passing inconvenience. They are a sign that something greater is out of order. It could be the environment, diet, medication, emotional state, or a combination of all these factors. What matters most is recognizing that interrupted sleep is a kind of noise that disrupts the body and mind's harmonious functioning. And the sooner this noise is heard, the sooner it can be corrected. The body needs full nights to restore itself, nights with a beginning, middle, and end, because sleeping well is what allows us to wake up with vitality, clarity, and true health. There are nights when sleep fails, not because of the environment, not because of age, and not because of diet. There are nights when the body lies down tired but cannot remain surrendered. What interferes with rest in these cases is not external, it is internal. It is thoughts that never quieted, sorrows left undigested, anxieties that hid during the day but become audible in the darkness of night. A sudden awakening in the middle of the night, when the room is silent and everything seems in order, may be the subtle language of an unresolved emotion, an anxiety that turned into an alarm, a fear never named but silently activating the body. This is one of the most important and least discussed aspects of sleep in older age, the role of repressed emotions in nighttime awakenings. Aging brings with it a series of profound emotional transformations. The loss of loved ones, children leaving home, retirement, physical decline, fear of becoming dependent, memories of past decisions, or the feeling of no longer belonging in a youth-centered world, all of these accumulate inside an elderly person who remains lucid. And often out of habit or modesty, these emotions are kept quiet. Complaints are silenced, tears are withheld, vulnerability is masked. But the body still feels, and the brain still records. And at night, when the world goes quiet, these unresolved emotions become powerful triggers for wakefulness. The body wakes because the mind, even unconsciously, remains on alert. It's as if something within whispers, something remains unresolved. it is not yet safe to fully let go. Studies from the University of Pittsburgh, in collaboration with the U.S. National Institute on Aging, showed that older adults with moderate to high levels of anxiety exhibited more frequent nighttime awakenings, especially between 2 and 4 a.m. This window, known as the limbic hyperactivity phase, is when the brain enters its deepest emotional regulation processes. If there is accumulated emotional overload, this stage is often disrupted, causing people to wake without understanding why, with tightness in the chest, shortness of breath, or vague thoughts, and often unable to fall back asleep. Another crucial insight is that emotions such as loneliness, prolonged sadness, and feelings of uselessness directly interfere with sleep. An elderly person may not say they are depressed, but may wake every night at exactly 3 a.m. with a sense of emptiness in the chest. This pattern repeats like an emotional clock. Waking at the same hour consistently may be the biological reflection of a specific emotion manifesting with precision. The autonomic nervous system, which regulates involuntary functions such as heart rate, breathing, and sleep rhythm, is deeply influenced by emotional states. When there is unspoken psychic distress, the sympathetic nervous system remains active longer, preventing a full descent into the deeper stages of sleep. This is not just about being anxious or being sad, but about living in a baseline state of emotional discomfort, often invisible even to the person experiencing it. The routine continues, the words remain gentle, but the body is already screaming in the middle of the night. And unless this emotional signal is acknowledged, it tends to become chronic. Many older adults spend years waking up without any apparent reason, believing it's simply a part of aging, when in reality, they're carrying an accumulation of unheard silences. That's why healing sleep also requires healing the soul. And that doesn't necessarily mean formal therapy. It means allowing oneself to feel, to write down what hurts, to talk with someone you trust, to pray sincerely, to remember those who are gone, and allow yourself to cry, to revisit untold stories, to give space to what was denied for too long, because sleep is not just a physical process, it is an emotional surrender, and no one can truly let go while carrying unresolved internal tensions. Sleep is an act of trust. Trust that the world can wait, that the body is safe, that the mind can rest. And if there is something within us saying otherwise, that something needs to be welcomed, heard, and gently dissolved, the night is a mirror. It does not lie. And when it insists on waking us, perhaps what's missing is not a pill, but a meeting with oneself. Sleeping is not just resting. Biologically, sleep is a therapeutic process that recharges the body's defenses against the invisible world of microscopic threats. During the night, especially in the deepest phases of sleep, the immune system activates a cascade of processes that range from the production of repair proteins to the strengthening of cells that patrol the body for threats. This silent operation is what allows the body to respond powerfully to viruses, bacteria, inflammation, and damaged cells. But when sleep is fragmented, this internal work is interrupted. And from that moment on, the body begins to operate with less reaction capacity, less defensive energy, and less strength to remain healthy in the face of challenges it once handled with ease. What makes this connection so critical is that immunity doesn't fail overnight. It fades slowly, first through mild infections that take longer to resolve, then through recurring allergies, followed by episodes of colds, herpes, candidiasis, or deep fatigue after minor activities. All of these are signs that the immune cells are becoming less effective. Research published in the journal Sleep has shown that individuals with disrupted sleep experience a significant drop in natural killer cell activity, the ones responsible for identifying and destroying infected or cancerous cells. That drop reached up to 70% in just 1 week of poor quality sleep. In the context of aging, where immunosenescence already weakens the immune system naturally, this impact becomes even more dramatic. During deep sleep, the body also releases a range of anti-inflammatory cytokines that help regulate chronic inflammation, a common issue in older adults dealing with arthritis, osteoarthritis, autoimmune conditions, or cardiovascular disease. Fragmented sleep not only reduces the release of these protective cytokines, but also increases the production of pro-inflammatory agents such as interleukin-6 and tumor necrosis factor. This creates an internal environment of silent inflammation, where the body operates in a constant state of alert, draining vital energy on pointless internal battles. This kind of inflammation over time accelerates tissue aging, promotes plaque buildup in arteries, contributes to muscle loss, and raises the risk of developing degenerative diseases. Another critical point is the body's ability to respond to vaccines, something especially important in older age. Studies from the University of Washington Sleep Medicine Center revealed that elderly individuals with fragmented sleep showed a lower immune response to vaccines for influenza, hepatitis B, and pneumonia. This happens because immune memory, the process through which the body retains long-term protection, depends on the quality of sleep during the nights following vaccination. If that sleep is disrupted by repeated awakenings, the immune response weakens, and the effectiveness of the vaccine decreases, even in people who appear to be healthy. The truth is that the body can only fully defend itself when it has the time, space, and conditions to carry out its repair work. And this only happens at night, when the immune system takes center stage, a role it cannot perform during the day. Deep sleep is the only time when the body is not distracted by external tasks, digestion, or environmental responses. During that sacred interval, it turns inward, and when that interval is broken by repeated wakefulness, the healing process is suspended. The immune system needs continuity, depth, and inner silence. It does not function well with forced interruptions or with half the time it needs. And when that lack of time repeats night after night, the body begins to suffer, not through a dramatic failure, but through a sequence of small, accumulating defeats that slowly erode its protective power. Nighttime awakening, therefore, is not just a subjective inconvenience. It is a physiological rupture with real consequences. Even if the older adult doesn't notice the effects in the short term, the body is already feeling them. It is registering. It is trying to compensate. But that compensation has a limit. And when that limit is reached, illness sets in with greater severity. The answer to this cycle is not sleeping more, but sleeping better. It means recovering sleep continuity as one would recover a forgotten source of healing. Because the immune system is silent, but it speaks clearly when denied the time to act. And the night, when truly respected, is its greatest ally. There is an almost invisible detail that separates a night of restorative sleep from a night filled with repeated awakenings. That detail is not inside the body, it's around it. It lies in the bedroom where one sleeps, in the intensity of the light, in the hidden noises outside the window, in the air temperature, the texture of the mattress, and even the color of the walls. The environment in which the body rests can be the greatest ally of sleep quality, or the silent enemy that, night after night, activates subtle sensory alerts that prevent the body from diving into deep sleep. For many elderly individuals who wake frequently during the night, the problem isn't only in the body or the emotions, it's in the surroundings. Surroundings that have been neglected for so long, they now feel normal. The first factor is light. The human body, especially the brain, is extremely sensitive to the presence and color of light. The retina contains photoreceptor cells that send direct signals to the suprachiasmatic nucleus, the core of the biological clock. Even with closed eyes, small sources of light in the room, like a digital display, a charger light, a street lamp seeping through a crack, or a TV on standby, can be enough to suppress melatonin production. And without melatonin, sleep cannot deepen. The presence of white or blue light during the night is interpreted by the brain as a signal that it is still daytime. This keeps the body in a light state of alert, even while sleeping, which makes awakenings more likely and prevents full completion of sleep cycles. Sleeping in complete darkness, or as close to it as possible, is a simple yet profoundly restorative gesture. Continuous darkness tells the brain it is safe to fully rest. Another critical factor is sound. Often, older adults believe they sleep in silence, when in fact they are exposed to low-frequency noises that the brain registers even without full awakening. Distant traffic, the ticking of a clock, the hum of an appliance, or the high-pitched sound of a device. All of these are enough to activate the vigilance of the central nervous system. This is especially true for those living with underlying emotional tension, as the brain keeps an unconscious radar always on, ready to react. In studies conducted by German researchers, older adults exposed to environmental noise between 30 and 45 decibels experienced a 23% increase in micro-awakenings per hour, even if they had no memory of these events the next morning. The brain wakes, even if the body doesn't notice. Room temperature is also decisive. Deep sleep only sets in properly when the body's core temperature drops slightly. This means the room needs to be cool and ventilated, but not cold. Stuffy bedrooms, lack of airflow, or heavy blankets can create a sense of thermal suffocation, forcing the brain to return to lighter sleep stages to regulate temperature. This unconscious effort fragments sleep cycles and reduces their restorative power. The general recommendation is to maintain the room between 18 and 22 degrees Celsius, with moderate humidity, light bedding, and a mattress that allows efficient thermal exchange. Details like these, when overlooked, can sabotage entire nights. Another essential factor is spatial organization. The human brain responds to its environment much like an animal reacts to its nest. Disorganized spaces, cluttered with objects, overstimulating to the eyes, make it harder to relax. Even with eyes closed, the subconscious senses the chaos, the overload, the discomfort. A minimalist room, with few elements, neutral tones, well-positioned personal objects, and no electronic stimuli, sends a direct signal to the limbic system that the space is safe. And safety is the absolute prerequisite for the brain to allow full entry into deep sleep phases. This becomes even more crucial for older adults who live alone, as the environment becomes their main emotional and sensory regulator. This isn't about luxury or aesthetics, it's about neurophysiology. The body can only sleep deeply when the environment communicates that everything is in order, and that communication happens silently, with lights off, muffled sounds, comfortable temperatures, and a welcoming space. An older adult who wakes multiple times each night may often find the invisible causes of their insomnia right in their own bedroom. And by correcting the environment, they can radically transform their sleep quality, without medication, without extreme effort, just with attention and sensitivity. Rest begins outside the body, before it reaches the brain. And the bedroom is not just a room, it is the temple of sleep. If it is at peace, the body can finally rest. There is a moment in the day when everything begins to take shape. It's not when the body lies down, nor when the eyes close. It happens before that. What takes place in the final hour before sleep often determines whether the night will be filled with deep rest or restless awakenings. This period, overlooked by so many, is what sleep specialists call the transition window. It is a physiologically delicate moment when the body begins to slow down, the brain starts to reduce its electrical activity, and sleep hormones begin to be released in response to darkness and the absence of stimulation. But when this window is invaded by noise, bright light, cell phone screens, arguments, worries, or any kind of sensory or emotional stimulus, the brain interprets that it is not yet time to shut down, and the sleep induction process is sabotaged right from the start. Many people report that they fall asleep easily but wake up shortly after and can't get back to sleep. In many of these cases, the problem lies in the ritual of that final hour. When the body falls asleep, while the nervous system is still active, as if sleep was forced artificially, the depth of rest is reduced. It's as if the mind sleeps with its eyes open, ready to wake at the slightest signal. The result is light, fragile sleep, easily disrupted. And even if the body appears still, the brain is not truly at rest. This type of sleep, when repeated night after night, is one of the most damaging to the nervous system, weakening memory and dysregulating mood. The TV left on, the phone in your hand, flashing notifications, bad news on the screen. All of this generates micro-stimuli that keep the brain in an alert state. The retina captures the blue light from these screens, which blocks melatonin production, the very hormone that should be rising at this time. The brain then delays its entry into the deep phases of sleep, and even after the devices are turned off, the mind remains active longer. It's like trying to sleep right after running. The body is still moving on the inside. This kind of pre-sleep stimulation causes the first sleep cycle of the night to be superficial, unstable, and shorter. And since deep sleep mostly occurs in the first few cycles, the damage is immediate and accumulative. Furthermore, the last hour of the day is often when thoughts rise to the surface. When the daily rhythm slows down, silence settles in and distractions fade, the things we've suppressed throughout the day tend to emerge. Worries about health, memories from the past, internal guilt, family frustrations, all find space to manifest. And if there is no ritual to process this, a moment of stillness, a light conversation, reflective writing, deep breathing, or even a sincere prayer, these emotions invade the sleep territory and become triggers for sudden awakenings, often between 2 and 4 in the morning. That's why turning the last hour of the day into something sacred is an essential strategy for restoring sleep in later life. Dimming the lights, avoiding screens, choosing soft music or a peaceful book, doing slow stretches, taking a warm shower, or simply sitting in silence are ways of signaling to the nervous system that the day is over. This silent communication allows the body to shut down with trust without resistance. And when the body surrenders to the night with calmness, the darkness is no longer a threat. It becomes a space of true restoration. Good sleep doesn't begin at bedtime. It begins an hour earlier. And when that hour is respected, everything changes. It prepares the body, calms the mind, and aligns the emotions. That's the space where sleep finds its passage. And if that passage is open, what follows is a full night, with a beginning, a middle, and an end. A night that doesn't need to be interrupted. A night in which the body can finally rest completely. The relationship between food and sleep is direct, profound, and often underestimated. What you put on your plate in the hours before bedtime has the power to shape how your brain functions throughout the night. And especially in old age, this connection becomes even more delicate. Metabolism slows down, the digestive system becomes more sensitive, and hormonal regulation grows more vulnerable to the wrong kinds of dietary stimuli. Eating late, eating too much, or choosing the wrong foods can turn sleep into an internal battlefield where the body is forced to divert energy from restoration to digestion. The result is light, broken sleep, often accompanied by restless dreams or nighttime heat. The reverse is also true. Some foods have the ability to ease the transition into sleep, deepen its stages, and reduce awakenings, if consumed wisely. The first critical point is the timing of the last meal. When dinner is too late, the digestive system is forced to work at full speed just when the body should be winding down. This delays melatonin release, raises core body temperature, and interferes with the onset of deep sleep. Moreover, a full stomach presses against the diaphragm, alters breathing, and in many cases triggers acid reflux, one of the most frequent causes of nighttime awakening among older adults. The general recommendation is to have the last meal of the day at least 2 hours before lying down, giving the body enough time to initiate digestion before sleep begins. Second, what you eat is just as important as when you eat. Foods high in saturated fats, fried items, heavy red meats, aged cheeses, processed meats, spicy sauces, and sugary desserts with a high glycemic index all stimulate the release of hormones like insulin and ghrelin, both of which interfere with melatonin production. These foods also increase brain activity, promote adrenaline release, and heighten the risk of nighttime micro-awakenings. Even in those who fall asleep easily after a heavy dinner, sleep tends to be fragmented, with fewer deep stages and a higher incidence of nightmares or restless movement. On the other hand, some natural foods act as silent allies of sleep. Tryptophan, an essential amino acid found in foods like bananas, oats, chickpeas, warm milk, eggs, and pumpkin seeds, is a precursor of serotonin, and therefore of melatonin. Consumed in small amounts in the evening, tryptophan helps the brain produce the neurotransmitters needed to relax, slow down, and begin sleep. Magnesium, found in dark leafy greens like spinach, kale, and broccoli, as well as in nuts and almonds, works as a natural nervous system relaxant, reducing anxiety and improving the quality of deep sleep stages. And vitamin B6, found in foods like avocado, sweet potatoes, and light fish such as salmon and sardines, supports the synthesis of sleep and mood-related neurotransmitters. Drinks also play a crucial role. Coffee, black tea, green tea, cola-based sodas, and dark chocolate all contain caffeine and should be avoided after 5 p.m., as their stimulant effects can last up to 8 hours in the body. Alcohol, though it may initially promote relaxation, directly interferes with sleep architecture, reducing REM sleep, increasing apnea episodes, and prompting awakenings between 3 and 5 a.m. On the other hand, calming teas such as chamomile, lemon balm, passion flower, or lavender can be helpful when used in a ritualistic and moderate way, especially if paired with a dark, peaceful environment. How you eat also affects sleep. Eating in a rush, in front of the TV while arguing, or while thinking about the day's problems, activates the sympathetic nervous system, the one responsible for the stress response. This blocks proper digestion and disrupts hormonal signals meant to prepare the body for rest. Eating slowly with mindfulness, in silence or to gentle music, transforms dinner into a physiological transition towards sleep. It becomes a quiet invitation for the body to let go. What you eat at night, therefore, is more than a dietary choice. It's a decision that shapes your night. It's the construction, or the destruction, of the terrain on which your body will rest for hours. Eating lightly, nutritiously, with emotional awareness and respect for timing is one of the simplest, most effective pillars for restoring sleep in later life. And by transforming nighttime eating, you also transform the beginning of every night, turning it from a battlefield into a temple of silent regeneration. For many older adults, nighttime is not a seamless stretch of rest, but a fragmented routine marked by constant trips to the bathroom. Waking up once, twice, or even 3 times to urinate becomes a seemingly inevitable habit, accepted as a natural part of aging. But what few realize is that these interruptions, even if brief, silently destroy the continuity of sleep and prevent the brain from reaching its deepest restorative phases. A bladder that wakes at night may seem like just an overactive organ, but in truth, it's a physiological marker of internal disarray. Understanding why it behaves this way is the first step toward reclaiming peace in the middle of the night. As the body ages, hormonal and neurological changes alter the way the bladder stores and responds to urine. One of the main factors is the reduction in the production of antidiuretic hormone, also known as vasopressin. This hormone is responsible for slowing urine production at night, allowing the body to remain at rest without needing to empty the bladder. In young adults, vasopressin naturally increases at night, slowing the kidneys, but in older adults this nighttime surge is often insufficient, leading to continuous urine production and the urge to urinate during the night. In addition, the bladder's muscular wall loses some of its elasticity over time. This makes it less capable of holding larger volumes of urine without sending discomfort signals to the brain. Even small amounts are interpreted as an urgent need. This bladder overreactivity is often linked to mild neurological changes, overactive bladder syndrome, or medications that stimulate urination. More importantly, the aging brain becomes less selective about bodily signals. While a young brain can ignore mild urges during deep sleep, an older brain reacts more quickly, waking the body in response to even minor cues. Fluid intake also plays a central role. Many older adults, fearing dehydration, drink large amounts of liquid in the final hours of the day. Water, teas, soups, fruits with high water content, all of this is processed by the kidneys and inevitably turned into urine overnight. The same goes for diuretic foods like watermelon, cucumber, coffee, and especially antihypertensive medications with diuretic effects, which should, whenever possible, be taken in the morning. The combination of late fluid intake and an active renal system results in constant overnight urine production. The problem is that every bathroom trip, however brief, resets the sleep cycle. The body rises, blood pressure increases, muscles contract. The light in the room activates the retina, and the entire process of diving into deep sleep must begin again. This doesn't just steal minutes of rest, it disrupts the hormonal cycle that should remain uninterrupted. People who wake multiple times to urinate rarely reach REM and N3 stages properly. This results in more fatigue, more forgetfulness, greater irritability, and weakened immune function the following day. There's also an emotional factor that's rarely discussed: the fear of incontinence. Many older adults go to bed carrying a constant tension, worried that their bladder might fail during the night. This subtle state of alertness prevents the body from surrendering fully to deep sleep. Sleep itself becomes partial vigilance, the brain monitoring bodily signals in the background, and this silent tension is what fragments rest the most. Even if the person doesn't fully wake, they remain in a state of readiness, which, biologically, is the opposite of sleep. It is possible, however, to reverse or significantly reduce this pattern. Among the most effective strategies are reducing liquid intake in the 3 hours before bedtime, concentrating water consumption in the morning and early afternoon, avoiding diuretic foods at dinner, adjusting the schedule of medications that increase urination, keeping the room cool to reduce sweating and thirst, and consulting a urologist to investigate possible bladder dysfunctions. In some cases, the cause may be benign prostatic hyperplasia, recurring urinary infections, or hormonal imbalances requiring treatment. Reclaiming nighttime sleep requires not just discipline, it requires awareness. The bladder that speaks at night is calling for reorganization, and every response the body receives during the night determines how it will function the next day. Sleeping through the night should not be a privilege of youth, but a biological right preserved into old age. And that right begins with listening carefully to the body, even when it's speaking from the bathroom. In older adulthood, medications become part of the daily routine. Pills to control blood pressure, capsules to protect the stomach, tablets for the heart, for pain, for mood, for cholesterol, for glucose, for blood circulation, and even for sleep. These are essential medications, the result of decades of scientific progress, capable of prolonging life and preserving vital body functions. However, what many fail to realize is that some of these very medications, while protective during the day, may silently disrupt the night. They can fragment sleep, cause micro-awakenings, alter hormonal rhythms, and sabotage rest in ways that go unnoticed. And because older adults typically take multiple medications simultaneously, identifying which one is interfering with sleep can be a challenge, but it's a necessary investigation. Among the main culprits are diuretics. Prescribed for high blood pressure and heart failure, these drugs increase fluid excretion through the kidneys, helping reduce blood volume and pressure. But when taken in the evening or late afternoon, their diuretic effect continues through the night, forcing patients to get up once or more to urinate. As discussed previously, these repeated interruptions destroy deep sleep continuity and impair restorative sleep cycles. Ideally, and when medically possible, these medications should be taken in the morning, allowing their effects to wear off before bedtime. Another group of drugs frequently associated with sleep disruption are antidepressants, especially selective serotonin reuptake inhibitors, SSRIs. While essential in treating depression and anxiety, many of these medications alter the architecture of sleep by reducing REM stages or making sleep lighter. They may also cause side effects such as restlessness, night sweats, or vivid dreams, each contributing to nighttime awakenings. That's why ongoing psychiatric follow-up is vital to adjust dosage, timing, or switch to compounds more compatible with restorative sleep. Corticosteroids, widely used to treat inflammation, autoimmune disorders, and respiratory conditions, are powerful stimulants of the hypothalamic pituitary adrenal axis. This means they increase cortisol levels, the stress hormone, which should naturally be at its lowest during the night. When taken late in the day or in high doses, corticosteroids keep the body in a chemically alert state, making it difficult to fall asleep or stay asleep. The insomnia they cause may occur even without visible mental agitation. The body simply resists surrendering to rest. Beta blockers, used for treating hypertension, arrhythmias, and cardiac issues, are also noteworthy. While effective, some beta blockers reduce melatonin production, the hormone responsible for initiating and maintaining sleep. Patients on these medications, especially when taken at night, may develop mild insomnia or early awakening without understanding the cause. Sometimes a simple change in timing or switching to a different drug within the same class with fewer sleep-related side effects can dramatically improve sleep quality. There are also statins, antacids, antihistamines, and certain painkillers that, when combined, may have cumulative effects on the central nervous system. On the other hand, sleeping pills themselves, like benzodiazepines and hypnotics, while offering immediate relief, may in the long term distort the natural architecture of sleep, reduce deep sleep, and lead to dependency. They also increase the risk of nighttime falls, confusion upon waking, and short-term memory loss. These medications must be used temporarily, always under careful supervision by experienced professionals. It's essential to understand that an older adult's body doesn't metabolize medications like a younger one. The liver slows down, kidneys filter less efficiently, and neurological sensitivity is heightened. What was once a safe dose may now be excessive. That's why regular reviews of all medications in use are crucial. Geriatricians and clinical pharmacists can assess interactions, adjust timing, switch compounds, and help restore sleep, not by adding more pills, but by minimizing their interference. Sleeping well in older age is not just about rituals or the comfort of a pillow. It also requires a body clean enough to surrender to sleep without chemical obstacles. The right medication at the wrong time can be more harmful than helpful. And when the body wakes up night after night for no apparent reason, it may be time to ask, is a pill stealing the sleep it was meant to protect? You sleep through the night, or at least you think you do. You wake up in the morning with no memory of interruptions, yet your body feels heavy with fatigue that doesn't match the 8 hours you spent in bed. Your mind feels foggy, your body moves slowly, your muscles ache as if they never truly rested. The day begins under a cloud of exhaustion, as if sleep failed to fulfill its purpose. And in many cases it did, because sleeping isn't just about being unconscious for a few hours. It's about moving through complete cycles of restoration, and those cycles can be shattered in mere seconds. Seconds that leave no memory but carry a heavy price. These seconds have a name: micro-awakenings. Micro-awakenings are brief episodes, lasting 2 to 15 seconds, in which the brain shifts from deep sleep into a state of alertness. They're not full awakenings, you don't open your eyes or move, but rather subtle activations of the brain that interrupt the architecture of sleep. Most of the time they leave no memory. You remain lying down, eyes closed, but in that instant, your brain stops repairing and starts monitoring. When these episodes are occasional, the body compensates. But when they become frequent, sometimes happening dozens of times per hour, sleep stops doing its biological job. Studies by the American Academy of Sleep Medicine show that individuals over the age of 60 experience an average of 5 to 15 micro-awakenings per hour of sleep. This number can be even higher in people with mild respiratory disorders, such as snoring or undiagnosed neurological conditions. What's most concerning is that these awakenings don't cause discomfort or recollection. The elderly person believes they slept well, while their brain spent the night rebooting, losing precious time to consolidate memories, repair tissues, and regulate emotional balance. These invisible awakenings are triggered by multiple factors: subtle environmental noise, body temperature fluctuations, minor sleep apnea events, physical discomfort, joint pain, hormonal variations, and especially unconscious anxiety spikes. When the nervous system is mildly hyperactive, even without obvious symptoms, it maintains a baseline alertness that shows itself at night through these interruptions. It's as if the brain sleeps with one ear open, reacting to any signal, internal or external. This prevents a sustained descent into N3 and REM stages, compromising sleep's restorative power. The impact of micro-awakenings is immense. They drastically reduce the production of key nighttime hormones like growth hormone, essential for cellular renewal, and melatonin, which regulates circadian rhythm and strengthens immunity. They also interfere with memory consolidation and may accelerate the buildup of beta-amyloid plaques in the brain, associated with neurodegenerative diseases like Alzheimer's. The brain needs uninterrupted sleep to carry out its nightly cleanup process, and these awakenings break that process into scattered, incomplete fragments, like trying to tidy a room but constantly being pulled away. There are ways to detect these episodes, even without conscious awareness. Chronic morning fatigue, unexplained muscle soreness, daytime sleepiness despite an apparent full night's sleep, short-term memory lapses, irritability, and trouble concentrating are all indirect signs of fragmented rest. Polysomnography, a detailed sleep study, can reveal these awakenings and help diagnose hidden causes. But even without testing, practical changes to your sleep environment, breathing, nutrition, and bedtime habits can significantly reduce their frequency. Micro-awakenings aren't harmless just because they're brief. On the contrary, they are insidious because they go unnoticed. They steal moments from each sleep cycle until by the end of the night you may have 8 hours on the clock, but only 4 hours of restorative sleep. That's why so many people live exhausted without understanding why. Recognizing these invisible moments is the first step toward reclaiming sleep that truly heals. Because sleeping well isn't just about not waking up. It's about not being woken up, even on the inside. Imagine that during the night while your body rests and your eyes remain closed, oxygen stops reaching your brain for a few seconds. Imagine this happening dozens, maybe hundreds of times, night after night, for months or even years. And the most terrifying part, it happens without you even knowing. This silent phenomenon has a name, is common in older adults, and is one of the most serious causes of sleep fragmentation. It's called obstructive sleep apnea, a respiratory disorder in which the upper airways temporarily collapse, blocking airflow and forcing the brain to wake up to regain control of breathing. These awakenings usually leave no memory, but they inflict deep damage on both body and mind. Sleep apnea becomes more prevalent with age, especially in men, but it also affects many women after menopause. The loss of muscle tone in the throat, fat accumulation around the neck, changes in bone structure, and hormonal shifts make the airways more vulnerable to collapse during deep sleep. The result is repeated breathing interruptions, forcing the brain to exit deep sleep just so the person can breathe again. These awakenings are often so brief that they're not remembered, but they're enough to break the sleep cycle and prevent entry into the most restorative phases. The clinical signs of apnea aren't always obvious. Loud and irregular snoring is common, but not always present. Many older adults with mild or moderate apnea don't snore at all, yet show other symptoms that, together, tell a clear story. Excessive daytime sleepiness, difficulty concentrating, irritability, morning headaches, dry mouth, nighttime choking sensations, or waking with a racing heartbeat. In more severe cases, apnea can trigger cardiac arrhythmias, drug-resistant hypertension, hard-to-manage diabetes, and increased risk of stroke. Studies from Stanford University have shown that individuals with untreated sleep apnea are up to 3 times more likely to develop dementia compared to those with normal sleep. That's because a brain repeatedly deprived of oxygen suffers micro-injuries in areas responsible for memory and emotional regulation. Moreover, a lack of deep sleep impairs the brain's nightly cleansing process, a system that relies on the circulation of cerebrospinal fluid to remove toxic waste accumulated during the day. Diagnosis is made through a test called polysomnography, which monitors brain activity, oxygen levels, respiratory rate, and awakenings throughout the night. Even in its mildest form, apnea is enough to sabotage rest. Treatment depends on severity. In mild cases, simple measures like changing sleep position, losing weight, practicing breathing exercises, or using nasal dilators can be effective. For moderate to severe cases, a CPAP machine may be required, a device that delivers continuous airflow to keep airways open throughout the night. While it may be uncomfortable at first, CPAP use has been linked to dramatic improvements in alertness, memory, mood, and blood pressure control. Sleep apnea is, therefore, a deceptive condition. It doesn't hurt, it leaves no visible marks, and it doesn't wake you with a sound, but it wakes your body from the inside, thousands of times. This invisible exhaustion, building silently into forgetfulness, irritation, and unexplained illnesses, must be heard. Stopping your breath during sleep is not normal. Feeling drained after a full night's rest is not just a part of aging. When your body wakes itself night after night, something is wrong. Because sleep, when deep and uninterrupted, is the most powerful medicine for aging. And apnea, when left unnoticed, steals that medicine one drop at a time. Sleep is above all the mind's regulator. It is in the darkness of the night that the brain organizes what was lived, dissolves what hurt, reinforces what matters, and discards what no longer serves. Sleeping well is not just resting the body, it's realigning emotions. And when that process is interrupted, whether by brief awakenings, bathroom visits, silent apneas, or inner unrest, the aging brain begins to accumulate what it didn't have time to process. The next day, the body may move, but the mind lags behind, weighed down by unresolved emotions. Over time, this leads to a state of chronic emotional fatigue, persistent discouragement, and a sadness with no clear reason, often diagnosed as depression. Depression in older adults is often silent and mistaken for the natural signs of aging, but it is not normal, and fragmented sleep is one of the major triggers of this emotional imbalance. Studies published in the Journal of Psychiatric Research show that older adults who wake more than twice a night are up to 3.5 times more likely to develop depressive symptoms compared to those who sleep through the night. That's because a brain deprived of deep sleep stops producing sufficient levels of essential neurotransmitters like serotonin and dopamine. At the same time, it increases nighttime release of cortisol, the stress hormone, which blocks emotional recovery. Sleep fragmentation also clouds mental clarity. Older adults with interrupted sleep have more difficulty making simple decisions, organizing thoughts, staying focused, and even finding everyday words. This cognitive fog, often perceived as forgetfulness, slow thinking, or lack of interest in conversation, slowly erodes self-confidence. The person begins to withdraw from interactions, avoids social encounters, speaks less, and gradually falls into a cycle of isolation. This isolation, fueled by emotional exhaustion, deepens the sadness and sense of disconnection from the world. There is also a deep impact on resilience. Sleeping well makes us stronger in the face of challenges. A rested brain sees problems with more perspective, tolerates frustration with more balance, and finds solutions with greater creativity. But a fragmented brain lives in survival mode. Small obstacles seem insurmountable. Criticism feels like an attack. Mistakes feel like failures. Even small changes in routine become triggers for insecurity. Sleep is the brain's emotional filter. Without it, everything hits raw, hurting where it should simply be processed. What makes this relationship even more dangerous is the vicious cycle that sets in. Poor sleep leads to anxiety, irritability, and sadness, and those emotional states make it even harder to sleep the next night. The elderly person begins to go to bed already fearing they won't sleep, their mind racing, anticipating the fatigue of the next day, and that anticipation becomes a ritual of silent suffering, where night, instead of being a place of comfort, becomes a space of anguish. Repeated over weeks or months, mood drops, energy fades, and life loses color. But this story can be rewritten. Restoring sleep is restoring mental health, and that begins with recognizing that persistent sadness, constant fatigue, or apathy are not signs of weakness or just old age. They are signs of a brain too tired to balance itself. The good news is that the brain never loses its ability to reorganize. It needs help, time, and nights of real sleep. A proper sleep treatment, paired with emotional support, meaningful activities, and authentic human connections, can completely transform the emotional state of an older person. It's not just about sleeping more, it's about sleeping whole, with continuity, depth, and peace. Because when sleep embraces the brain again with care, the mind also learns to dream again. And dreaming, even at 80, even after all the pain, is still the most beautiful way to keep on living. Sleep doesn't begin when the sun goes down. It begins the moment the day begins. From the very first step out of bed, every decision, every movement, every food or emotional choice builds, brick by brick, the road the body will walk when night falls. It is during the day that the brain receives the signals it will later process. And if those signals are chaotic, rushed, or confusing, the sleep that follows will reflect the same pattern. Sleeping well, therefore, is a side effect of living with awareness during the day, and it is this awareness that can, slowly but surely, return to older adults the peace that the night has taken away. The first habit that defines sleep is exposure to natural light early in the morning. Morning sunlight is the strongest regulator of the human biological clock. It activates the neuroendocrine axis, halts melatonin production, and sends the brain a clear message. It's daytime. Wake up. When received consistently, this signal aligns the circadian rhythm, that internal clock that governs our natural times for sleep and wakefulness. Older adults who expose themselves to morning sunlight for at least 20 minutes, especially between 7 and 9 a.m., show more regular sleep cycles, fewer awakenings, and deeper sleep phases like N3 and REM. Without this habit, the body loses track of internal time, leading to fragmented sleep, daytime fatigue, and difficulty falling asleep at night. Light to moderate physical activity during the day is another silent ally of restorative sleep. Walking outdoors, breathing exercises, gardening, yoga, or even rhythmic stretching help regulate blood pressure, balance cortisol levels, and increase the natural production of endorphins and serotonin. But the benefit is not just biological, it's emotional. Movement activates the body and lets the mind release energy, and a mind that moves during the day rests more easily at night. Ideally, these activities should be done before the evening, as nighttime exercise can have a stimulating effect for some and make it harder to fall asleep. Another fundamental point is managing daytime naps. Napping is not forbidden. On the contrary, a brief rest after lunch can be beneficial as long as it lasts between 20 and 30 minutes. Sleeping longer or taking multiple naps throughout the day disrupts the circadian rhythm and reduces the body's natural pressure to sleep at night. Sleep is governed by two systems, the circadian cycle and homeostatic pressure. The second, what we might call sleep thirst, only builds up with sustained wakefulness. Long naps drain that thirst, resulting in a body that's too alert at night even if tired. Daytime nutrition also plays a key role in sleep regulation. Eating at regular times, avoiding long fasts or overeating, and maintaining proper hydration during the day are practices that stabilize metabolism and prevent nighttime triggers such as hunger or thirst. Additionally, steering clear of inflammatory foods, ultra-processed items, or those high in refined sugars reduces the production of inflammatory cytokines, substances that, in excess, interfere with melatonin production and raise cortisol levels. And finally, perhaps the most overlooked of all, managing the mind throughout the day. Repetitive thoughts, persistent worries, repressed emotions, and the lack of emotional expression create an invisible buildup of mental tension. If not released through conversation, journaling, meditation, or human connection, this burden shows up at night as insomnia or restlessness. An elderly person who spends the day in total silence without verbalizing what they think or feel ends up taking all of that to bed. And the bed is no place to process what the day refused to hear. That's why cultivating moments of dialogue, emotional release, listening, and lightness throughout the day is one of the most powerful ways to prepare the mind for rest. It must be understood. The night is not an isolated compartment. It is the consequence of everything that was built during the day. A poorly lived day, even within four walls, even in silence, becomes a restless night. But a day with light, movement, connection, laughter, nutrition, and awareness almost always turns into a night of deep, continuous, restorative sleep. Because sleep, like health, doesn't begin at bedtime. It begins each morning, in the decision to live with intention. There is a kind of fatigue that doesn't come from the body but from the mind, an exhaustion that goes unseen yet quietly accumulates between the lines of thought, in silent gestures, and in sleepless nights. It's chronic stress, a low-grade anxiety, a permanent state of alert that many older adults carry without even realizing it. It's not a panic attack or an overt fear. It's subtler, a knot in the chest that never unties, a mental list that never ends, muscle tension that never truly relaxes. This silent stress, when prolonged, becomes a constant saboteur of sleep, and perhaps the hardest one to recognize and resolve. The human nervous system operates in two main modes: the sympathetic mode, which prepares us for action, and the parasympathetic mode, which guides us into rest and regeneration. For sleep to occur naturally, the sympathetic system, the one in charge of vigilance, organization, and reasoning, must slow down and give way to the parasympathetic. But when the mind remains in a state of continuous alert, even without overt crises, the body fails to make this transition. It's like trying to fall asleep with the engine running. The body may be still, but the internal systems remain active. And this constant activation, though invisible, blocks the entry into the deeper phases of sleep. In older adults, this phenomenon becomes even more complex. The aging mind, filled with a lifetime of experiences, fears, losses, and family responsibilities, tends to maintain a psychic state of watchfulness. The fear of getting sick, of forgetting, of becoming dependent, of losing autonomy, of no longer being useful, all of this, even when unspoken, echoes in the background. At night, when the world quiets and silence settles in, these thoughts grow louder. And even if the body is lying down, the mind stays on guard. This results in micro-awakenings, difficulty falling asleep, restless dreams, and a lingering sense of shallow rest. Furthermore, chronic stress deeply alters the hormonal axis that governs sleep. Cortisol, which should decrease by nightfall, stays elevated. Melatonin, in turn, is blocked or insufficiently produced. This hormonal inversion throws off the circadian rhythm, making it difficult not only to fall asleep but to stay asleep. And worse, the more restless nights one has, the higher the baseline level of cortisol the next day, creating a vicious cycle in which the body never truly shuts down. This persistent state of activation also affects memory, mood, and immunity. Research published by Harvard Medical School shows that older adults with high stress levels face increased risk of developing dementia, depression, and recurrent infections, all conditions linked to the deprivation of deep sleep. A tired and anxious brain loses its ability to regulate emotions, overreacts to minor stimuli, and interprets the world as more threatening than it actually is. And that emotional state, when prolonged, distances the body from the serenity it needs to sleep well. The solution isn't found only in one-time relaxation techniques, but in building a new relationship with one's internal rhythm. The regular practice of mindful breathing, guided meditation, nighttime journaling, evening wind-down rituals, daytime nature exposure, and, above all, meaningful conversation are ways to disarm that internal alert system. The brain needs to learn that night is not a time for vigilance, but for surrender. And surrender only happens when it feels safe. Safe to rest, to let go of control, to trust that the world will keep spinning, even without it awake. It is also essential for families and caregivers to recognize this form of silent stress. Not all anxiety manifests as agitation. Sometimes it appears as excessive silence, isolation, short answers, or an overly rigid routine. These are signs of a mind in containment, trying to maintain control at all costs, and that mind needs to be welcomed, heard, and understood. Because more often than not, what prevents sleep isn't the body, it's the soul that's still awake. The human body is built on cycles. The heart beats in rhythm, breathing repeats in cadence. For sleep to truly exist, it must have structure. And in old age, when retirement sets in, when the children have left home, when social demands fade and daily routines grow quiet, something essential is lost: the sense of continuity. The absence of appointments, schedules, goals, and frequent interactions turns the days into blank pages. And without the structure of the day, the nights lose their foundation. A mind that no longer expects anything from tomorrow also loses the impulse to rest today. Sleep, once a necessary recovery after effort, becomes an unstable, restless state without clear function. Deep sleep is born from a feeling of closure. It happens when the body understands that the day has ended, that the task is done, that there's meaning in resting because there will be a new beginning the next day. When this cycle is broken, when all days look the same, when the clock no longer marks any difference, when there are no more goals, visits, commitments, learning, or real reasons to get up, the brain slips into a state of suspension. It neither speeds up nor slows down. It merely continues. And sleep, which depends on clear contrasts between activity and rest, between light and darkness, between motion and stillness, becomes fragmented, shallow, and lacking depth. This phenomenon is extremely common in old age. Many elderly individuals live in a kind of passive waiting. They wake because the sun is up, eat because it's time, watch television to pass the hours, and go to bed because there's nothing else to do. This unstructured routine, though seemingly comfortable at first glance, causes an internal collapse of biological rhythms. The absence of purpose weakens the production of hormones like serotonin and dopamine, which are natural precursors to melatonin, the hormone responsible for sleep. And without this biochemical cycle, the brain stops sending the right signals for when to shut down. Even more than that, the lack of purpose generates silent anxiety, a vague discomfort, a feeling of lost time, of uselessness, of not belonging. This emotion, even if never spoken aloud, lives in the thoughts at night, turning rest into a melancholic vigil. The bed stops being a place of recovery and becomes a stage for memories, regrets, longing, and often anguish. When tomorrow promises nothing new, the body takes longer to surrender to tonight's rest. But purpose doesn't have to be grand. It's not about returning to work or having a heroic mission. It's simply about having something to look forward to: a coffee date with a friend, a garden to tend, a book to finish, a grandchild to teach, a new course to follow, a small project to move forward. The mind needs to believe there's a reason, and this belief reorganizes the entire internal system. When there is meaning, sleep returns to its true role, because now it serves to restore the body for something that lies ahead. The body sleeps better when it knows it will be needed again. Research by the National Sleep Foundation shows that older adults engaged in meaningful activities, with well-defined routines and consistent social bonds, show more regular sleep cycles, greater deep sleep efficiency, and fewer episodes of chronic insomnia. That's because the interpretive brain, the one that needs to make sense of the world in order to function, depends on symbols, on goals, on trajectories. And when those structures are in place, biology responds. The internal clock realigns, mood stabilizes, anxiety recedes, and the night finally becomes night again. So, sleeping well in old age is more than just closing your eyes. It's believing, even silently, that the next day is worth it, that something awaits, that life still makes sense, and that resting is part of that meaning. Sleep, in the end, is a vote of confidence in tomorrow, and when that tomorrow is empty, the brain retreats. But when there is purpose, however modest, the brain smiles quietly, and with gratitude it falls asleep. There's a secret the ancients understood, and science now confirms. The human body responds better to symbols than to commands. No one sleeps just because they want to. Sleep isn't a switch, it's a surrender, and every surrender needs preparation. That's why the moments before lying down are more important than most imagine. They represent a transition, an invisible hallway between the outer world and the inner world. It's in that hallway that the mind must be gently led, and the more structured that moment is, the more the body understands that it's safe to let go. Nighttime rituals aren't luxuries, they're maps. And for the elderly who've spent a lifetime under the weight of duties, fears, and losses, those maps may be the key to sleeping as if time had turned back. The first rule is to respect the process of slowing down. The body doesn't sleep well when it goes from high speed to silence in minutes. It needs a ritual to gently announce the end of the day. Dimming the lights after 8 p.m., turning off screens at least an hour before bed, allowing silence to gradually fill the house. All of this signals to the brain that the day is over. As the retina receives less blue light and more shadow, it sends a signal to the pineal gland to begin producing melatonin, and the body gradually shifts into a different rhythm. Warm lighting, candles, a quiet atmosphere, all of these become invitations to rest. The next step is turning the bath into a ritual, not a rushed mechanical shower, but a warm and gentle one, as if offering the body a gesture of kindness. Warm water relaxes the muscles, lowers peripheral tension, reduces blood pressure, and helps wash away the marks of the day. When done mindfully, this bath becomes a symbolic closure to the day's journey. It's a final punctuation mark, one that must be felt, so the body doesn't carry into bed what should have been left behind. Then comes the preparation of the room. The bedroom must not be an extension of the day's chaos. It needs to be a sanctuary. Clean sheets, well-positioned pillows, a comfortable temperature, and the absence of loud noises. If possible, scent the air with lavender or chamomile, both proven to have calming effects on the nervous system. Removing strong visual stimuli helps quiet the visual cortex and eases entry into slow-wave sleep. Many older adults also benefit from soft background sounds, white noise, flowing water, or low-frequency music, which act as sound frames to help the brain disconnect from internal chatter. Then, the ritual of mental unloading. Writing, for example, is a powerful tool. A notebook by the bed where one can jot down worries, unfinished thoughts, emotional wounds, not to solve them, just to name them. The simple act of turning thought into word lowers activity in the limbic system, which governs anxiety. Likewise, a prayer, a gratitude reflection, reading something light, or listening to a guided meditation can serve as emotional drainage channels. The brain, feeling supported, can finally let go and sleep. And finally, the simplest and most powerful gesture, to lie down with gentleness, not like someone collapsing, but like someone surrendering. Take 3 deep breaths. Feel the body on the mattress. Allow each part to release its stored tension. Let the shoulders drop, release the jaw. Let the eyes begin to rest even before they close. Deep sleep is often just seconds away, but it only arrives when the body feels safe. And safety is built in silence, in ritual, in repetition. Sleep science has shown that no medicine teaches the body to sleep better than a consistent nightly ritual. The brain craves predictability. And when, night after night, it sees the same cues, the dimmed lights, the relaxing bath, the welcoming notebook, the adjusted pillow, it begins to trust. And it is that trust that allows an elderly person, so often weary, to rediscover a rest they thought they had lost forever. Sleeping well is a right, and like every right, it can and must be reclaimed. The silence of a bedroom at night can carry many sounds. Some fall asleep, wrapped in the rhythm of a loved one's breathing. Others, even in total quiet, hear only absence. In old age, after life has changed so many routines and taken so many familiar faces, the bed ceases to be just a place of rest. It becomes an emotional mirror. The body either surrenders or resists, not just from exhaustion, but from companionship or the lack of it. And it is in this intimate space that emotional connection, often invisible to medical diagnoses, emerges as one of the most powerful factors in achieving deep, healing sleep. Studies from the University of Pittsburgh have shown that long-time couples who share a bed often develop unconscious synchronization of breathing and heart rate during the night. This means that simply sleeping next to someone with whom there is emotional connection can lead to mutual regulation of the nervous system. This co-regulation promotes a sense of psychic safety, emotional grounding, and deeper, more restorative sleep cycles. It's no coincidence that many people report sleeping better when their partner is close. The body, sensing the presence of the other, lets go more easily. The feeling of protection, of continuity, of being held, allows the mind to release control. But when that presence is lost, through widowhood, separation, or emotional distance, sleep also breaks. Not always from sharp grief, but from a void that quietly settles into the body like a missing reference point. The bed that was once shared now feels too large. Silence shifts from peaceful to echoing, and sleep, once easy, begins to delay. In many cases, insomnia after the loss of a partner isn't just physical, it's emotional. It's the brain trying to reorganize in a world where a vital part of its emotional rhythm is gone. Sleeping alone after years of sleeping together is learning, again, how to feel safe in the dark. But sharing a bed can also be a challenge when there are unspoken tensions. Elderly couples who sleep together but live apart emotionally may experience the opposite of co-regulation. In those cases, the shared space doesn't create safety, it creates strain. Snoring, physical discomfort, mismatched routines, or accumulated frustrations can turn a shared bed into a space of friction. And when these things go unspoken, the body absorbs the conflict. One begins to sleep poorly without knowing if it's age or resentment. Often what's missing isn't silence, it's reconnection. In such cases, sleep improves not with separate beds, but with rejoined hearts. And then there is the power of touch. Human touch, especially loving, intentional touch, has a direct effect on lowering cortisol and boosting oxytocin, the hormone of emotional bonding. A simple handhold before sleep, a kiss on the forehead, a nighttime hug. These gestures have more effect on the nervous system than many prescriptions. These small acts, repeated night after night, serve as emotional anchors, and when the brain feels loved, it sleeps more peacefully. For those who sleep alone, it is possible to rebuild that feeling of presence. A nightly self-care ritual, a warmed pillow, a meditation with a human voice, a cherished memory gently revisited. All of this creates an emotional safe zone, even in physical solitude. Loneliness doesn't have to be a void. It can be a sanctuary. As long as the elder feels seen, respected, and held, the body, even aged, still responds to love. And love, even in silence, remains one of the most powerful sleep medicines we have. What science tells us, and life confirms, is that sleep is not merely biological, it is relational. We sleep better when we feel we belong, and in old age, that sense of belonging is often what separates a restful night from one filled with quiet wakefulness. So caring for an elder's sleep means more than adjusting hormones or fine-tuning routines. It also means tending to their connections, because a peaceful heart always sleeps better, even when on the outside everything looks the same. Throughout life, we collect advice. Some come from family traditions, others from neighbors, television, or well-meaning professionals. And amid this flood of instructions, sleep has become one of the most distorted areas, shaped by myths repeated so often that they've come to be accepted as truth. But modern sleep science, especially when applied to aging, debunks many of these beliefs. Understanding what truly applies to the aging body can be the difference between quietly suffering and finally sleeping with depth and peace. The first and perhaps most damaging myth is that needing less sleep is a normal part of aging. that older adults simply don't need as much rest. This notion, although widespread, is deeply mistaken. What changes with age is not the need for sleep, but the ability to maintain it. The body still requires the same 7 to 8 hours per night. What changes is the sleep architecture. Older people tend to experience lighter, more fragmented sleep, with shorter periods of deep rest and more awakenings. But that doesn't mean they need less sleep. It means they need more care to ensure the sleep they do get is truly restorative. Another widespread myth is that daytime naps ruin nighttime sleep. This is only true when naps are too long or happen repeatedly throughout the day. A short rest after lunch, ideally no longer than 30 minutes, can actually be extremely beneficial, especially for seniors who had a rough night. These brief naps help restore energy without disrupting the homeostatic pressure that drives nighttime sleep. The key is balance. Napping isn't a flaw. It's a smart adjustment as long as it's done wisely. A third harmful myth is the idea of self-sufficiency. Many seniors believe that because they've always slept without help, they shouldn't need support now. But sleep changes with age. Hormonal shifts, medication use, natural brain aging, and emotional losses demand new strategies. Denying that need for adjustment only prolongs the struggle. Seeking help from sleep specialists, psychologists, or respiratory therapists is not a sign of weakness. It's a sign of emotional intelligence and self-respect. There's also the false belief that falling asleep with the TV on is helpful. For many elderly people, the constant background noise offers a sense of company. But the blue light emitted by screens, even when the eyes are closed, directly disrupts melatonin production. The brain receives that light and interprets it as a signal to stay alert. The result is shallower sleep and a sharp reduction in restorative phases. If sound helps, it's better to opt for soft alternatives, such as instrumental music, white noise, or audiobooks with a calming voice. Another misconception is that alcohol helps people relax and sleep better. Alcohol may cause drowsiness at first, but it seriously disrupts the architecture of sleep. After drinking, sleep becomes fragmented. REM phases are drastically reduced and nighttime awakenings multiply. Additionally, alcohol causes dehydration, interferes with body temperature regulation, and may worsen sleep apnea. The initial calm it seems to bring is deceptive, and the cost is a restless night and an even more exhausted morning. And finally, one of the most dangerous myths of all, resignation. The idea that it's normal to feel tired all the time just because you're over 60. This belief is often a mask for something that can and should be treated. Chronic fatigue, morning irritability, forgetfulness, and the feeling of not being fully present aren't just signs of aging. They are often clear symptoms of poor sleep, and poor sleep can be addressed. Aging with clarity, vitality, and joy isn't a privilege. It's a right for those who learn to care for their rest as seriously as they care for their diet, their blood pressure, or their heart. Breaking down myths isn't easy. They carry emotional roots, family memories, and sometimes a false sense of comfort. But dismantling them is liberating, because behind every false belief, there's an opportunity to reclaim better nights. And when sleep returns, everything returns with it. Memory, energy, mood, the will to live. Sleeping well isn't a luxury. It's the foundation for aging with dignity. Night begins long before we lie down. It begins at the table. And what we choose to place on our plate, especially in the final hours of the day, can either be the gateway to a night of deep rest or the source of a fragmented, restless, and shallow sleep. As the body ages, the digestive system slows down and becomes more sensitive. Foods that once seemed harmless now require more effort to process, inflame more easily, and become silent triggers for wakefulness and nighttime discomfort. Understanding the impact of nighttime eating is one of the most intelligent ways to care for sleep health, and therefore for the overall well-being of the elderly. The first principle is clear. The body needs time to shut down. Heavy meals rich in saturated fats, refined carbohydrates, or difficult-to-digest proteins consumed shortly before bedtime force the digestive system to stay active throughout the night. This keeps the metabolism elevated, raises body temperature, and prevents the body from entering the deeper stages of sleep. Intense digestion consumes energy, causes abdominal discomfort, and can lead to silent reflux, one of the main culprits behind micro-awakenings that often go unnoticed but directly impact sleep architecture. On the other hand, prolonged fasting, or an extremely light dinner can also disrupt rest. Nocturnal hypoglycemia, although more common in people with diabetes, can happen to any elderly person who eats too early and goes to bed many hours later, especially if they are under stress or taking certain medications. When blood sugar drops too low during the night, the body activates its alert system, releasing cortisol and adrenaline. The result is a sudden awakening, sometimes with sweating, a racing heart, or restlessness, often without an obvious cause. At that moment, the body is simply trying to survive a nutritional imbalance. The ideal evening meal should be balanced, light, and calming. Warm dishes made with cooked vegetables, whole grains, small portions of healthy fats, and lean proteins, such as eggs, light fish, or small servings of chicken, promote fullness without overloading the stomach. Foods rich in tryptophan like bananas, oats, chickpeas, and seeds support the production of serotonin and melatonin, two key hormones for inducing sleep. A gentle herbal tea like chamomile, lemongrass, or fennel can also serve as a cue for slowing down, preparing the body for rest. Another key point is the timing of the last meal. Eating too late forces the digestive system to work while the body is trying to fall asleep, often resulting in light sleep and restless dreams. Ideally, dinner should be finished at least 2 hours before bedtime to allow digestion to begin without hunger returning. Contrary to what many believe, a structured eating routine during the day, with consistent meal times, has a direct impact on the regulation of the circadian rhythm. The body interprets regularity as a sign of safety, and safety is one of the pillars of deep sleep. It's also essential to examine the emotional relationship with food at night. Many elderly individuals, especially those living alone, use the evening meal as an emotional outlet. They eat in front of the television, in silence, without real hunger, but in search of comfort. While understandable, this habit often leads to overeating and less healthy food choices. The act of eating should be done with attention, presence, and affection. Even a simple meal, when prepared with care and eaten slowly, sends a message of self-compassion to the body. And a body that feels cared for relaxes, and a body that relaxes sleeps better. Food, therefore, is more than just nutrition. It's also a language. It speaks to the body about safety, balance, and predictability. And these are exactly the sensations the body needs to surrender to deep sleep. A well-prepared plate at night is an invitation to rest. And when that invitation is extended with awareness, each dinner becomes a sacred ritual of preparation for the peace that lies ahead. Old age often comes with a growing list of pills. Pills for the heart, for blood pressure, for cholesterol, for pain, for the stomach, for memory, and inevitably for sleep. But what many fail to realize is that within this complex web of substances mixing in the body every day often hides the true villain of sleep. When medication is poorly adjusted, it interferes with biological rhythms, alters brain chemistry, and turns sleep into a distant goal. Sleeping becomes less a natural process and more a struggle that depends on aids that not only fail to deliver on their promises, but can also come at a steep cost to mental clarity and personal independence. One of the first groups of medications that deserves close scrutiny is antihypertensives, especially beta blockers. These can reduce melatonin production, making it harder to fall asleep. Diuretics, when taken later in the day, increase the need to urinate during the night, fragmenting sleep and preventing progression into deeper sleep stages. Many older adults take these medications at night out of habit or lack of guidance, unaware that they may be sabotaging their sleep unintentionally. A simple change in timing, under medical supervision, can make a tremendous difference in sleep quality. Another sensitive category includes antidepressants and anti-anxiety medications, especially benzodiazepines, which are still widely prescribed. While they may induce sleep quickly in the early weeks, they promote an artificial type of sleep with reduced REM time, the most critical phase for memory consolidation and emotional regulation. Over time, the brain adapts to their presence and loses its natural ability to sleep independently. The result is a tolerance, requiring higher doses for the same effect, and dependence, more turning the pill into a shackle. Even worse, these drugs increase the risk of falls, cognitive confusion, nighttime delirium, and even dementia, according to studies from the American Geriatric Society. Even medications that seem harmless can indirectly impact sleep. Corticosteroids, commonly used for joint pain or autoimmune conditions, raise cortisol levels and keep the nervous system alert. Bronchodilators, used for asthma or COPD, stimulate the sympathetic system. Older antihistamines, though sedating, disrupt the brain's neurochemical balance, affecting sleep depth. The same applies to urinary tract medications, which may alter bladder muscle function, but can also cross the blood-brain barrier, triggering nighttime confusion and mental fog. The result is often this: poor sleep, not because of age, but because of a daily chemical cocktail. And since sleep deteriorates, the patient returns to the doctor and gets prescribed yet another medication, usually a sedative. Thus begins a cycle where the symptom is treated, but the cause remains hidden. The medication list grows longer, alertness shrinks, daytime drowsiness worsens, the risk of falls increases, and the older adult who just wanted to sleep ends up living in a fog of substances that strip away the vitality they still could enjoy. The way out of this maze begins with a thorough medication review. A vigilant geriatrician, knowledgeable in the pharmacology of aging, can determine which medications are truly necessary, which could be replaced with alternatives less harmful to sleep, and which combinations are quietly disrupting rest. This process, known as a pharmacological review, can significantly reduce the number of medications without compromising disease control. In fact, it often improves the very symptoms that led to those prescriptions in the first place. Sleeping well in old age also requires courage, the courage to question, to ask if that pill is still necessary, if the dose still makes sense, if there are other ways to manage discomfort through physiotherapy, lifestyle changes, psychotherapy, relaxation techniques, nutrition, or carefully built nighttime rituals, because at its core, restful sleep was never gone. It just needs room to return, and sometimes that room is precisely what too many pills take away. Sleeping is not just about closing your eyes, it's about entering an inner space of surrender where the body must trust that it is safe enough to shut down. And that trust is not built solely through thoughts or feelings, but through the environment. The place where one sleeps, the bedroom, the bed, the lighting, the sounds, even the scent, communicates to the brain whether it can relax or must stay alert. The body interprets its surroundings, and in old age, when physical and emotional sensitivity are heightened, these environmental cues become even more decisive. A poorly adjusted mattress, an unnecessary light left on, or a constant background noise. All of these seemingly small details might be the reason behind those restless nights that keep repeating themselves. The mattress is the first point of contact between the body and sleep. A good mattress for the elderly needs to support the spine without being overly firm, while also relieving pressure on sensitive areas like the shoulders, hips, and knees. As we age, the skin becomes thinner, the joints more fragile, and the muscles offer less protection. Sleeping on a mattress that's too hard can trigger micro-awakenings caused by postural discomfort, even without conscious awareness. Meanwhile, mattresses that are too soft fail to support spinal alignment, leading to pain upon waking. The ideal lies in balance, often in medium-firm models that offer both support and comfort. The pillow too must suit the person's usual sleeping position, maintaining natural neck alignment and avoiding strain. Nighttime lighting is another crucial factor. Even minimal light can suppress melatonin production, the hormone that regulates sleep. The retina remains sensitive even with closed eyelids. Blue light, such as that emitted from TVs, smartphones, or cold LED bulbs, is especially harmful, sending a signal to the brain that it's still daytime, delaying the onset of the circadian cycle. That's why the ideal evening setting involves gradually dimming the environment, using indirect, warm, and soft lighting, ideally placed below eye level. For those who need to get up during the night, low-intensity amber night lights are helpful, avoiding full reactivation of the brain. Room temperature also plays a direct role in both falling and staying asleep. The human body naturally begins a slight drop in core temperature before sleep, a biological mechanism that eases the transition into rest. When the room is too hot or too cold, this adjustment is disrupted. Studies suggest the ideal temperature for deep sleep ranges between 64 and 72 degrees, 18 to 20 seconds, with variations depending on individual sensitivity. For older adults, it's vital to balance thermal comfort with air circulation. Lightweight clothing, natural fabrics, and layered blankets help the body adapt to nighttime changes. Overly heavy bedding or sealed-off rooms should be avoided, as heat buildup can cause restlessness and frequent awakenings. Then there's sound. The bedroom must be a place of restorative quiet, but total silence isn't always possible. Street noise, neighbors, household sounds. In such cases, creating a sound barrier may be necessary. Constant and gentle background noise, white noise, rain, a fan, ocean waves, helps the brain focus on a single frequency, masking abrupt external disturbances that can interrupt sleep. What matters is avoiding irregular sounds or sudden volume changes. The aging brain is more sensitive to sudden stimuli, and what might not wake a young person can be enough to fragment an older adult's sleep. Finally, the environment must feel emotionally safe. The bedroom should evoke calm, familiarity, and warmth. Beloved photographs, subtle scents like lavender or vanilla, blackout curtains, a familiar piece of furniture that brings back comforting memories. All of this creates a setting of trust where the body allows itself to rest. The brain needs to recognize the bedroom as a sanctuary, not a space of tension. When the room becomes a source of discomfort, the body hesitates. But when it becomes a nest, sleep arrives naturally. Sleeping well is not just a biological process, it's also an environmental response. And often the key to better nights isn't found within the body, but around it. A well-prepared bedroom is a silent embrace, a gentle invitation, a promise that in this space wakefulness can finally let go. It's not always insomnia that steals sleep. In many cases, what fragments the night and robs deep rest are silent diseases, chronic medical conditions that manifest subtly during the night and, over time, sabotage health without making noise. The elderly person wakes up tired, drowsy, with a foggy mind, believing they've slept, but the truth is their body spent the night fighting. In these cases, poor sleep is not a problem in itself, but rather a symptom of something greater. And ignoring this signal is to allow the issue to spread unchecked. Among the most prevalent and dangerous conditions is obstructive sleep apnea. It's estimated that over 60% of elderly individuals suffer from some degree of this respiratory disorder, according to data from the Sleep Research Society. During sleep, the throat muscles relax excessively, temporarily blocking the airway. The brain, upon detecting the drop in oxygen, abruptly wakes the body, sometimes dozens of times per hour, without the person even realizing. The result is fragmented, superficial sleep, never progressing to restorative phases. Apnea is linked to high blood pressure, increased risk of heart attacks, strokes, cognitive decline, and even dementia. And in the elderly, it is often underdiagnosed, mistaken for simple snoring or the fatigue of aging. Another enemy of sleep is chronic pain, in the joints, back, muscles, or nerves. Diseases like osteoarthritis, fibromyalgia, diabetic neuropathies, and common musculoskeletal syndromes in old age create persistent discomfort that intensifies with rest. When the body is in full rest, attention turns inward, and the pain, which was muted by distraction during the day, grows louder. The elderly toss and turn, change positions frequently, activate the sympathetic nervous system, and the deep sleep, which requires immobility and relaxation, never comes. The cycle continues into the next day, bringing more fatigue, more pain, and greater emotional vulnerability. Type 2 diabetes, another frequent companion of aging, is also a subtle thief of sleep. Glycemic fluctuations at night cause agitation, sweating, palpitations, hunger, or nausea, even when the condition appears well controlled. In addition, nocturia, frequent need to urinate, associated with poorly managed diabetes, disrupts sleep at various intervals, especially between 3 and 5 a.m. Each time the body has to get up, the sleep cycle restarts, harming continuity. Studies published in the Journal of Clinical Sleep Medicine show that diabetic patients sleep on average 1 hour less per night than healthy adults of the same age group, and this chronic sleep deprivation has devastating effects on metabolism and immunity. Finally, gastroesophageal reflux, common in older adults, especially those who use anti-inflammatories, anxiolytics, or eat late at night, deeply disrupts sleep. Even when there is no noticeable pain, stomach acid may rise quietly during the night, triggering micro-awakenings, dry cough, choking sensations, or persistent throat clearing upon waking. Sleeping in a completely horizontal position facilitates this reflux, and when the body detects a threat to respiratory integrity, it activates an alert, even for fractions of a second, interrupting deep sleep cycles. What all these conditions have in common is invisibility. They don't scream. They interrupt. They make sleep light, fragile, and tiring. And when that happens for weeks, months, years, the body collapses. Memory fails, mood swings, immunity drops, and life loses its sparkle. Yet most elderly people living this reality don't realize the root cause is sleep, or rather the lack of it. The path to reclaiming rest begins with diagnosis. Investigating apnea with a polysomnography exam, managing pain through physical therapy and integrative strategies, stabilizing diabetes with proper diet and medication, controlling reflux with posture and dietary adjustments. Each of these actions gives the body a new chance to restore itself, because deep down, every aging body still knows how to sleep. It just needs to be left in peace, without struggle, without blockage, without pain. Sleep is a gift that can be recovered, and it all starts by recognizing what is silently getting in the way. There is a silent belief that destroys hope in old age, the idea that the body no longer changes, that what has been lost cannot be recovered, that once sleep becomes fragmented, it is doomed to remain that way until the end. But science in recent years has proven the exact opposite. The brain is not a fixed organ. It is moldable, adaptable, alive. Even at 70, 80, 90 years old, it continues to form new connections, reorganize networks, build new pathways. And this phenomenon, known as neuroplasticity, holds the key to one of the greatest revolutions in aging. The elderly brain can relearn how to sleep, deeply, continuously, and with pleasure. Neuroplasticity describes the brain's ability to modify its structure and function in response to experiences, learning, and external stimuli. In other words, what we repeat becomes a cerebral trail. If we spend years living under tension, with chaotic schedules, nighttime stimuli, repressed emotions, and an environment hostile to rest, the brain creates an insomnia map, a permanent state of alert. But in the same way, when the environment shifts, the routine is adjusted, thoughts are organized, and appropriate stimuli are introduced consistently, that map begins to fade, and a new path begins to take shape. Good sleep then becomes a skill that can be relearned and practiced until it becomes natural once more. Research from Stanford University has shown that elderly individuals who participate in sleep retraining programs involving behavioral, environmental, and perceptual changes were able to increase their total deep sleep time by over 40% in just 8 weeks. This happens because the brain, when exposed to new repetitive signals, begins to create an internal environment conducive to restoration, and this response occurs even in brains showing signs of aging or early cognitive decline. The key lies in repetition, consistency, and emotional safety. One example is the power of routine. When an older adult sets fixed times to go to bed and wake up, avoids long naps during the day, limits screen use at night, and adopts gentle rituals before sleep, they send the brain clear signals of predictability. Over time, these practices shape the function of the biological clock, also known as the circadian rhythm, and the brain, recognizing this new pattern, adjusts the release of hormones like melatonin and cortisol, restoring sleep architecture without the need for medication. The body falls asleep more easily, stays asleep longer, and wakes up more lucid. This isn't magic, it's neuroscience applied to life. Another pillar of sleep-related neuroplasticity is cognitive reframing. Many elderly individuals have developed a negative emotional relationship with sleep over the years. They associate the bedroom with frustration, boredom, loneliness, or the fear of not being able to fall asleep. These emotions trigger the sympathetic nervous system, creating a state of alert, exactly the opposite of what sleep requires. Through techniques such as cognitive behavioral therapy, guided meditation, conscious breathing, and mindfulness practices, the mind can be retrained to associate sleep with safety, comfort, and surrender, and the brain, in its plasticity, responds. It learns how to switch off again. It's important to remember that neuroplasticity doesn't require youth. It requires consistency. Even elderly brains burdened with decades of chronic insomnia respond to new stimuli when those are introduced with gentleness, patience, and regularity. And it's not just about sleeping better, it's about transforming sleep into an experience of healing. The night ceases to be a battle and returns to being a sanctuary. The bed stops being a field of anxiety and becomes a nest of repair. The mind, once scattered and distrustful, begins to trust the body again. And that trust is what allows the silent miracle of falling asleep, night after night, in serenity. Relearning to sleep, therefore, is an act of courage, of humility, of reconnection with one's natural rhythm. It is the belief that what was lost is not lost forever, and that even after a lifetime of restless nights, there is still time to discover the pleasure of waking up refreshed. The brain ages, yes, but it never stops learning. And when you teach it, with firmness and tenderness, that sleep is safe, it responds with gratitude, and it sleeps. For decades, the treatment of insomnia was associated almost exclusively with medication, a prescription, a dose, a promise of rest. But reality showed that this quick fix often became a trap. Side effects, dependency, mental confusion, increased risk of falls, artificial sleep. In old age, this model proved even more dangerous. And it was within this context that science began to explore different paths, deeper, more respectful of the body's complexity. Among them emerged one of the most promising approaches, CBTE, which stands for Cognitive Behavioral Therapy for Insomnia, a pill-free, evidence-based intervention that has been transforming the way older adults rediscover sleep. CBTI is a structured psychological protocol grounded in decades of research that targets the root causes of insomnia, not just its symptoms. Instead of artificially inducing sleep, it helps the brain relearn how to sleep naturally by dismantling limiting beliefs, adjusting dysfunctional behaviors, and reorganizing the cycles of wakefulness and rest. It is a therapy of reprogramming, not only of sleep, but of the person's relationship with the act of sleeping. And according to studies published in the Journal of the American Medical Association, CBTI is more effective than hypnotic medications in both the short and long term, with response rates exceeding 70% in older adults with chronic insomnia. The first pillar of CBTI is sleep restriction. Contrary to popular belief, spending more time in bed doesn't help you sleep. It often reinforces the association between bed and insomnia. The therapy advises patients to get out of bed if they've been unable to sleep for more than 20 minutes, avoiding turning the bed into a place of frustration. Over time, the body relearns that bed equals sleep, not anxiety. Another essential component is stimulus control. This includes practices like only going to bed when truly sleepy, maintaining consistent sleep and wake times, avoiding long daytime naps, and eliminating activities like watching TV, using a smartphone, or eating in bed. All of this is designed to restore a direct and positive association between the bed and rest, reinforcing this neurological link. CBTI also involves cognitive restructuring. Many older adults carry negative automatic thoughts about sleep. I'll never sleep well again. My body is failing me. I'll get sick if I don't sleep. These beliefs, while understandable, create anxiety and activate the sympathetic nervous system, preventing the very relaxation needed to fall asleep. In therapy, these thoughts are identified, challenged, and replaced with more realistic and functional beliefs that help break the insomnia cycle. The approach also includes deep relaxation techniques, such as diaphragmatic breathing, guided meditation, visualization, and mindfulness. These practices reduce the body's alertness level, trigger the parasympathetic response, and help create the physiological conditions needed for sleep. Over time, older adults come to feel that they have real tools within reach to calm the mind and signal the body that it's time to rest. What sets CBTI apart is its long-term effectiveness. Unlike medications, which only work while being taken, the results of behavioral therapy can last for years after the sessions end. That's because it changes the very foundation of behavior. The brain learns in a concrete way how to sleep better, and that learning solidifies into a new pattern, resilient, organic, and autonomous. For many older adults, CBTI represents a turning point, the possibility of recovering sleep without relying on pills, of reclaiming control over their nights, of no longer fearing the early hours. More than a technique, it is a liberation, and perhaps that's what older adults want most. Not to sleep out of obligation or exhaustion, but because the body finally remembers the way back home. And that path, when built with awareness, becomes permanent. During the day, life demands. There are bills to pay, medications to take, appointments to keep, news to follow. Time pushes, distracts, occupies. But at night, when the lights go out, the voices fade, and the body lies down, there are no more distractions. The silence of the room opens space for another kind of sound, the sound of memory. It is in that moment that the past, carefully tucked away in the deeper corners of the mind, finds the opportunity to rise. And in many cases, it is that past that prevents sleep. Because there are pains that were never named, griefs that were never mourned, words that were never spoken, and all of it lives on, not in sentences, but in sensations. It manifests when consciousness lets go. That is why so many elderly people wake in the middle of the night with a racing heart, with a nameless anguish, with tears trapped in the throat. In these cases, insomnia is a cry from the unconscious asking to be heard. Sleep science now recognizes this connection between psychological suffering and sleep disturbances. A study published in the Sleep Health Journal revealed that older adults with unresolved traumatic events, such as sudden loss, accidents, separations, abuse, or violence, show a higher risk of chronic insomnia, frequent nighttime awakenings, and recurring nightmares. The traumatized brain alters its perception of safety, and sleep, by definition, requires complete safety. It's not just about closing the eyes, it's about trusting. And when the mind associates darkness, silence, or solitude with painful episodes from the past, it keeps the alert system activated, even while the body tries to rest. Grief, in particular, is one of the most common and most misunderstood experiences of old age. Losing a spouse, a child, a sibling, or a lifelong friend, all of this reshapes the inner world. And when that grief is not processed with time, support, and compassion, it accumulates as emotional weight. The room that once housed two now holds one. The scent, the empty side of the bed, the clock still ticking the same hour, all become reminders. And even when the elderly believe they've moved on, the body remembers. The unconscious does not forget. Sleep then becomes a place of reunion with absence, and the night becomes the territory where longing speaks the loudest. There are also older traumas, often from youth or childhood, that were never addressed. Situations of domestic violence, emotional repression, abandonment, humiliation, or deep fear. Today's elderly generation grew up in a time when speaking about feelings was seen as weakness, when tears were swallowed and life went on. But what was swallowed remains, and what was never expressed finds other ways to surface. Persistent insomnia, restless nights, panic episodes at bedtime, the feeling of being watched, disjointed mental images, all of these may be the echoes of a past not yet integrated. And the key to easing these symptoms may lie less in pills and more in conversations, in listening, in therapy, in creative expression. The sleep of the elderly, therefore, should not be treated only with sleep hygiene and schedule adjustments. It must be treated with listening, with sensitivity. We need to ask, what still hurts? What remains stuck inside? What memory keeps repeating? Because each nighttime awakening can be a message, and each bout of insomnia can be an invitation to deep care. To care for sleep is also to care for the soul, and to care for the soul of an elderly person is to recognize that they are not only made of tired bones, they are made of stories. Stories that sometimes are still unfinished. It is possible to sleep peacefully, even with a difficult past. But that requires the courage to look inward, to name what was lived, to welcome what was never expressed, and to transform pain into wisdom. When that happens, sleep returns, and it returns clean, deep, and restorative, because the body finally understands that there is no more danger, that what needed to be felt has been felt, that what needed to be remembered has been honored, and that now, at last, it is possible to rest. Not all knowledge comes from books. Not all healing comes from medicine. Some lessons are born from daily life, from listening, from observing with care, and few things teach more than a true story. Because when an elderly person hears the account of another who has endured the same nighttime torment, the same anguish of lying down and not being able to rest, they realize they are not alone. And more than that, they realize there is a way out, a path, a transformation. Sleep can return. And it does, not through magical promises, but through deep changes, often small, almost invisible, yet capable of completely altering one's quality of life. What follows are some of those stories. Real, human, possible. Mrs. Celeste, 78, spent nearly a decade sleeping poorly. She woke every morning at 3 a.m., heart racing, mind full of thoughts, body exhausted. She tried every tea recommended to her, prayed, had tests done, visited multiple doctors, always leaving with a new prescription for tranquilizers, but sleep never fully returned, until, at her granddaughter's urging, she started therapy. That's when she discovered that it wasn't her body waking her. It was fear. Fear of dying in her sleep, fear of forgetting who she was, fear of missing a call in case something happened to her children. Silent, old fear. When she gave that fear a name, something began to shift. In time, she gave up the medication and started sleeping again. She still wakes up in the middle of the night sometimes, but now she knows what she's feeling, and that's enough to fall asleep again. Mr. Orlando, 82, had always been a practical man, a former military officer, disciplined. He didn't believe in anything that wasn't concrete. When insomnia began, he brushed it off as part of aging. He accepted it, resigned himself. But over time, the lack of sleep started to affect his memory, his mood, his patience. He began forgetting names, mixing up dates, snapping for no reason. His daughter, a nurse, convinced him to see a sleep specialist. There, they discovered he had severe sleep apnea. He began using a CPAP machine, and within weeks was sleeping deeply again. He said it felt like someone had given back a part of life he didn't even know he had lost. Today, he's a fierce advocate for proper diagnosis. He says, "Old age isn't a sentence, it's just another stage that requires intelligent care." Mrs. Marta, 74, had been widowed for 7 years. Since her husband's passing, she could no longer sleep in their shared bed. She set up a mattress in the living room, spent nights watching TV until she passed out, and still woke several times each night. She thought it was normal. That loneliness was just part of aging. But at an emotional health workshop for seniors held at the local clinic, she heard other women tell similar stories. And there, in that safe space, she cried for the first time in years. She went home, tidied up the bedroom, changed the sheets, placed flowers on the nightstand, and for the first time since her loss, returned to sleeping in her own room. She said it wasn't easy, but it was liberating. Now she sleeps with a soft radio playing and a photo of her husband beside the bed. And she sleeps well. These stories aren't exceptions, they are beacons, reminders that sleep isn't some random gift. It is sensitive, emotional, adaptable, and above all, it responds to care. Many older adults believe they're doomed to restless nights simply because they've grown old. But the reality is different. What's often missing isn't biological ability, it's emotional conditions, consistent practices, attentive listening. When an elder feels supported, respected, understood, sleep responds. The body relaxes, the mind quiets, the heart slows down, and the night at last becomes a sanctuary again. Sleeping well is possible, even after years of insomnia, trauma, loss, or mistaken habits. These real stories prove it. And they also prove that it's never too late to start again, never too late to learn how to rest. Because as long as there is life, there is sleep. And as long as there is sleep, there is healing. Sometimes the middle of the night arrives like a jolt. The clock strikes 3 a.m. The silence is deep. Everyone is asleep, except you. The room is dark, the body is awake, and the mind begins to race. In that moment, the first instinct is usually the same: to feel frustrated, to get upset, to believe that something is wrong. But what if it's not? What if this awakening, instead of a failure, is a calling, a request from the body to be heard, a silent attempt by the soul to reconnect with something forgotten? In old age, when time takes on new contours and silence has more space, waking in the middle of the night can paradoxically become one of the most precious opportunities for self-discovery and care. For a long time, medicine treated sleep as a purely physiological process. Hours slept, sleep stages, hormones. But ancient peoples knew that sleep was also spiritual, symbolic, emotional. The moment when the conscious mind goes quiet and the unconscious speaks. Buddhist monks wake at 3 in the morning to meditate. 18th century European peasants divided their sleep into 2 cycles, and in the interval between them would pray, write, or reflect. In Jewish tradition, the middle of the night is the most sacred time for speaking with God. What does all of this tell us? That waking up in the night may not just be a disorder. It may be an invitation, a sacred space, if lived with presence. This doesn't mean insomnia should be romanticized, but it can be redefined. If the body wakes, instead of panicking, why not ask what it needs? It might be a glass of water, a deep breath, a gentle stretch, or jotting down a thought that keeps returning. It might be a moment of silence, of gratitude, of connection to what truly matters. Rather than fighting the sleep that hasn't come, you can turn that moment into a conscious pause, a time to care for yourself without guilt, without urgency, without pressure. A moment that, paradoxically, prepares the body to return to sleep more easily. Many older adults, after shifting this perspective, say that their awakening stopped being a source of anxiety and became moments of reconciliation with their own life. One 85-year-old man, when asked what he did when he woke in the night, answered calmly, "I listen to my heart beating, and I give thanks that it's still beating." That simplicity, that surrender, that wisdom, these are the true remedies that medicine still cannot bottle, but that experience, when embraced, teaches masterfully. Of course, it's important to investigate physical causes, adjust habits, and seek professional help. But beyond all of that, an inner gesture is needed, a gesture of acceptance. The body speaks, and in old age it speaks more softly, but more truthfully. Each awakening can be a pause for the soul, and when the elderly understand this, something shifts. The fear of night fades, the anxiety loses power, and often sleep, at which seemed so distant, returns naturally, because now it is no longer demanded, it is invited. This script began with a question. Why has waking up at night become a routine? And it ends with another deeper one. What are these awakenings trying to show me? The answer is inside. And when it comes, not only does sleep improve, but so does life. Because sleeping well in the end is just one more way of living well, and living well is listening to your own body with respect, with curiosity, and with love. Even in the middle of the night,